Elevated cardiac troponin I as a predictor of outcomes in COVID-19 hospitalizations, a meta-analysis. Globally, coronavirus is causing more social, economic, and healthcare disruption than expected. The emerging literature has reported the complications of coronavirus and the mortality and risk factors involved, including cardiac injury and multi-system organ failure. In this meta-analysis, we aim to evaluate the association of elevated troponin I levels with outcomes in COVID-19 hospitalized patients. Observational studies describing troponin I levels and outcomes of COVID-19 hospitalized patients were identified. Data were extracted following PRISMA guidelines. Adverse outcomes were defined as admission to intensive care units, oxygen saturation less than 90%, invasive mechanical ventilation, and in-hospital mortality. The odds ratio and 95% confidence interval were obtained and forest plots were created using random effects models. 10 studies with 3,982 confirmed COVID-19 patients were included. In patients with poor outcomes, the prevalence of elevated troponin I levels was 51%. In meta-analysis, patients with elevated troponin I levels had higher odds of poor outcomes compared to better outcomes with pooled or of 7.92 with 70% heterogeneity. Our meta-analysis suggests that COVID-19 patients with elevated troponin I levels had a higher risk of poor outcomes. Take-home message: evaluating the troponin I levels might be helpful in preventing risk of cardiac complications and other organ dysfunction. For more details, below is the link for this interesting study. Please review it. Follow us for more videos related to research interpretation.